So, all right, ma'am, we are live and we are also getting started with the session. So, good evening to one and all present here. As the current moderator assigned to this session, my name is Mona Lisa. I extend my cordial greetings to all of the delegates from across the country. We sincerely appreciate all the doctors who have taken the time to join us today. Allow me to share significant highlights of ClearNet before we proceed to the session. It is one of India's major live digital CME platforms in India, which allows doctors to create their own medical content. Now, I would like to take this opportunity to welcome today's Master Doctor here, also known as speaker, Dr. Chitra Shriram Kulkarni. She did MBBS, MD in Pediatrics, PGDAP, CDC Kerala in the year 2007. So, once again, I would like to welcome all of you at today's lecture for the topic History Taking in Adolescents, HEADSS. So, before we get started with the session, let me take you all through the brief description of today's topic once. Adolescence marks a transitional phase between childhood and adulthood, pivotal for development. Key causes of illness and death among adolescents include accidents, suicide, homicide, obesity, sexually transmitted infections, unintended pregnancies, and substance abuse. So further discussion will be held by Dr. himself, herself. So without much delay, I would like to hand over the session to you, ma'am. Kindly proceed with it. Over to you.
Hi, fellow practitioners, the doctors who are listening here and connected to me. A warm welcome and good evening to all. I am practicing for last 37 years and adolescence is my passion along with the general pediatric practice. Whenever we see a child coming to our clinic for various elements like headache, leg pain, or tummy pain, and the parents have brought or the grandparents have brought him or her in your OPD, there are a lot of undercurrents go along with these overt symptoms. And sometimes it is very difficult to see everything in the busy OPD. So there is some tool which is very unique for adolescents to get your history properly, to have a probable diagnosis in your clinic without investigations. And this history is called as Heeadsss. The acronym is headache. Can you share the next slide? Next slide, please. Yeah. So what this Heeadsss means, we have to ask for the complaint a separate interview with that adolescent child, which is between 9 years to suppose 18 years. Ask about the home environment. How many family members are there? Where the home is located? Are there any issues in the home environment like parental conflict, somebody's addictions, or getting beaten up for minor issues, or if the child is admitted in your hospital for some other element, the hospital environment, whether the child is comfortable or not, his daycare center, and the surrounding of his home. You can get an important clue about the history or the examination finding and tone down, or it may add up. The another second important point is schooling, education. Some of the abdominal pains, which you obviously find get worsened on weekdays and the child is fine on weekends, can be related to the school or educational institutions or the tuition classes. In our country, usually children do not work when they are studying. But when you go abroad and ask for the history of an adolescent, where the 14, 15-year-old adolescent or teenager is out of his house and working as well as studying, the employment milieu is also very important. The third thing which we always ask and significant is the eating habits. There are a lot of food fadism, and the Western culture is seeping in our society as well, where the child doesn't prefer a homemade food and always order on Swiggy and Zomato and keeps on eating all kachra, what we say. Similarly, an adolescent of 13, 14-year age is concerned about his or her body image. They are having lot of binges, but then they may vomit out to reduce the intake and calories conscious girls especially. So definitely ask about how they feel about their own body. What is their role model? Sometimes it is Hrithik Roshan or sometimes it is Alia Bhatt. And be empathetic in asking all these questions. We have to assure them that the conversation will not go out of the consulting room, and unless is there any serious issue, we are not supposed to divulge these things with the caretakers as well. The fourth activity is out of school activity that child is doing. Many of the times, these kids are really entangled in a day's activity by parents. He or she may not like, but he has to go to a chess class or a drawing class or Bharatanatyam, and various experimentation is done with either music classes and so-called hobbies. Always ask them whether they like it or not. What are they doing after the school is over? During your questioning of their day-to-day routine and activities, please make a point to ask about the peer relations. How many friends are they having? What type of friends they are having? Is there any recent change in their peer group? What they have done to be included in that present peer group? You may get a clue about a different activity or fearfulness or sudden change in the behavior with the peer relations. Definitely ask about their social commitment. Those children who help the household chores with their mother or grandmother or the family members and take part in the social activities and attached to a NGO definitely have lot of positive impact in their life. If not, then we can suggest them. We stay in a metro city, and cities which are near to the metro are having a big impact of this drug menace even in the school. Can we ask it directly? आप दारू पीते हैं क्या, सिगरेट है क्या, स्मोकिंग है क्या? No, no child will reveal that. So how to ask about that? Ask about a friend. Any of your friend is having any drugs addiction issues? We are having this problem. Don't deny it. Then ask about the friend's name, the frequency, how much quantity he or she requires, how much money they may have to spend for continuing of these, and ask about the friends, not a fair idea about the alcohol consumption or their binges or smoking habits, whether it is weed or a prescription drug or inhalation of Fevicol or eating the drugs containing chocolates. Once you get this, you again have to assure that it will not be shared with anybody, but he or she has to cooperate to get out of this habit. Always assure them that divulging it to the treating doctor or pediatrician is the first step of improvement. Similarly, getting a mobile phone is a necessity nowadays, even for the parents, as most of the school curriculum is sent by WhatsApp on their mobile phone. When it's a smartphone, there comes the possibility of watching a pornography, and the next step is experimentation. So our fifth one S is about sexuality and sexual activity. Most of the adolescents who come for their issues of stomach pain, not eating, excessive sleepiness, they do admit that most of their friends are watching pornography on their smartphones. Then do ask about the sexuality, how they feel about their own body and how they feel about the opposite sex. But always tell them that it is not a permanent thing. As their body is growing, as their brain is growing, all the doctors, they know that the frontal cortex will be mature only by 24 years of age. So if it is not mature, the abstract thinking is also not possible. Labeling them with different sexuality, different body in different mind is not permanent. I think we must share to all the doctors and caretakers that not to label that child so early. Do ask about the sexual activity, and if the child reveals to you again with the friend 1 or 2 episodes, always advise them about contraception. And then we have to tell them that there are various methods of contraception where they can get it over the counter, and we can help them to avoid the unwanted pregnancy. The second S in our history is related to the mood. It is a study that 45 to 50% of adolescents can get negative emotions in their growing up period. Except that, tell that yes, it is possible, and up to what extent that depression or anxiety is there. Tell them about the panic attacks, the symptoms of panic attack, like increasing heart rate, feeling of thirstiness, sweating, want to lie down, and as against panic attack of anxiety, the feeling of hopelessness and helplessness comes with depression. And clearly asking them whether they have felt any time to end their life. It will not increase the risk of suicide if we ask this question, but we can get the idea where there is allowance to share this to caretakers. Also, share about any sexual abuse to the child. that is allowed in our history and according to guidelines about the sexual abuse or suicidal tendency, where we have to take help of mental health professional. The last but not least is social media. The safety and cyberbullying in social media is a reality, and is that related to the change of behavior of your child? Late night 2 a.m. kids is the next step where we have to interfere, because the child will not grow if the child is not sleeping for 8 hours. Cyberbullying and violence related to the activities of reels and internet and Facebook can lead to permanent scar on their mind. Do ask about bullying in the school, their present injuries which are inappropriate, and ask about the ragging which can be there even in the school or junior colleges. Next, please. Next slide, please. Yeah. So we have elaborated the history of Heeadsss. But what the Heeadsss will add? For the present illness of any infection which cannot be explained by the usual findings, do find some injection marks, do find the restlessness, do find out the teary eyes, sudden cough, rashes, red marks on the body, and a child who is excessively spending time in the toilet, where even the child when enters your cabin, you may smell something different, which gives valuable clue and suspicion of that child's illness, which may not be overt or known to the caretakers. Find out an abscess which is in the gluteal region or some different part of the body, and then you may get a clue why the fever is there. Always assess the risk of self-harm or suicide, which is treatable. And you have to take care of a team, the team of his her friends, teachers, caretakers, as well as mental health professionals. Convince the caretakers that this is required, maybe for 6 months, 1 year, 1.5 years, or even 2 years, to have a concrete plan of actions. And believe me, even after starting medicines, there may be few bumps. The road is not that straight. It's not a diagnosis of common cold or a typhoid fever. Mind changing takes time. And along with drugs which are temporary, we required REBT or CBT, like rational emotive behavior therapy sessions, for helping that child to come out of these issues. The legal responsibility is on us, our as a responsibility as a doctor, then mental health professional, as well as caretakers, even though the child refuses the treatment or hospital admission. Here, the of a family practitioner or a pediatrician plays a great role. Next slide is. Madam, next slide, please. We are now concluding our sharing of history of Heeadsss, and why I have chosen this topic, because it is easy to shape and evolving adolescent brain than to repair a broken adult who is having depression or suicidal tendencies. Thank you very much.
Thank you so much, ma'am, for your wonderful talk and presentation. It was very much lucid and comprehensive as well. Therefore, we have got a couple of queries from the participating delegates. With all your permission, I am sharing the questions. You can read the questions and answer according to it.
Okay. What information or resources have been provided to help the patient understand the importance of biopsy? Here, we have to first tell that we will not share whatever the child has shared to you, and we have to rule out the organic causes of the illness before blaming it to the psychological issues. Suppose the child is having constant abdominal pain, first we have to rule out the common causes of food-related infections, or suppose like irritable bowel syndrome, and then you can tell that this is related to the anxiety. Are there alternative treatment options that might be considered depending on the biopsy results? Yes, definitely. As I have shared in my talk, rational emotive behavior therapy, EBT or CBT sessions can be taken by a psychologist to change the thought process of that child. How can we address any fears or anxieties the patient may have related to the biopsy? Yes, I do agree. In first meeting with that child, the child may not reveal everything. Many of the times, the children say that, oh, why I have been brought here, I don't know. I am okay. But then we talk about the hobbies, their time pass, their favorite hero, heroines, or music. And then after 15 days, we ask them to come back again. And there we ask them that how the 15 days were there. And by third visit, the child starts opening up and share his or her anxieties related to the history of Heeadsss. Heeadsss is our psychological biopsy.
So thank you so much, ma'am, for answering all the queries of the doctors. I believe all of them have got their query answered. So with that, let's call it a day and we'll be meeting soon on this platform very soon. And last but not the least, I would like to request all the participating delegates, if you have any further queries based on today's session or speaker specialty, please do not hesitate to get back to us by following the social media platforms so that we can discuss further for another session. So thank you so much, ma'am, for your time and coordination, and thanks to all of you.
Thank
Good
you.
night, everyone.
Thank you very much.
You're welcome, ma'am.
Shall we close?
Yes, absolutely, ma'am.
Thank you.